This video is for educational purposes only and isn't meant to replace medical advice. Always talk to your doctor before making any health changes. Stuck on mood swings and low drive? Discover the delivery method that keeps you balanced. In this video, we'll explore 8 critical areas, from the hidden endocrine disruptors in our environment to the nuances of delivery methods, lab ranges, and even natural optimization tactics. You'll learn why the FDA reversed its heart disease warning on TRT, how to choose between creams, injections, or pellets, which cofactors you absolutely must address for true hormone balance, and what lifestyle foundations you can lay today to support your body's own hormone factor. Ready to power up your performance, mood, and health? Let's get into it. 1. Environmental chemicals is a major cause of low testosterone. Our modern world is saturated with endocrine disruptors, plastics, forever chemicals like PFAS, organochlorine pesticides, phthalates, and even airborne microplastics that infiltrate both urban and rural environments. These compounds mimic or block your natural hormones, confusing the Leydig cells in the testes and ovaries that manufacture testosterone. In my practice, I've spoken with dozens of men in their 40s who assumed their fatigue, low libido, and brain fog were just part of getting older. Instead, lab tests revealed chronically suppressed testosterone coinciding with high blood levels of BPA and phthalate metabolites. Longitudinal studies confirm this link. A 2019 Endocrine Review's meta-analysis showed men with the highest urinary BPA concentrations had up to 30% lower total testosterone than those with minimal exposure. It's not just ingestion. PFAS from non-stick cookware and Teflon-coated packaging can leach into food, and dust-borne microplastics settle in homes, schools, and offices worldwide. One of my patients, a 38-year-old teacher, saw his T levels jump from 280 to 550 N/DL within 3 months after switching to glass food storage and replacing all plastic cookware. To fight back, prioritize glass or stainless steel containers, choose organic produce when possible, install HEPA filters, and support your detox pathways with targeted nutrition. Think cruciferous vegetables, sulforaphane, and antioxidants like vitamin C and glutathione precursors. You can also add binders like activated charcoal or bentonite clay on protocol days to help clear heavy metals and persistent organic pollutants. But sometimes, lifestyle tweaks aren't enough, and that's when professional hormone assessment and tailored TRT become crucial tools in your arsenal. Comment ChemShield if you're ready to protect your hormones. 2. Debunking cardiovascular and prostate cancer myths about TRT. For decades, conventional wisdom warned that testosterone replacement therapy, TRT, increases heart attack risk and fuels prostate cancer. Patients, terrified by sensational headlines, often postpone treatment, enduring debilitating symptoms in silence. Yet the science tells a different story. A landmark 2024 systematic review in the Journal of the American College of Cardiology found properly dosed TRT reduces cardiovascular events by improving lipid profiles, insulin sensitivity, and endothelial function. Similarly, the belief that testosterone feeds prostate tumors originated from misinterpreted 1940s data. Recent laboratory work, most notably a series of cell culture experiments at Harvard Medical School, demonstrated that physiological levels of testosterone actually induce apoptosis in cancerous prostate cells, slowing tumor progression. These findings led the FDA to quietly remove heart disease and stroke warnings from TRT labels in April 2025, acknowledging that when managed correctly, hormone optimization enhances rather than harms cardiac health. Clinically, I've seen patients with coronary artery disease report fewer angina episodes and improved exercise tolerance after initiating TRT under careful monitoring. One 62-year-old retired firefighter even came off nitrates after 3 months of therapy because his chest pain fully resolved. That's why it's time to replace outdated dogma with up-to-date evidence, so men can regain strength and vitality without fear. Comment myth busted if you're ready to embrace the facts. 3. Comparing creams versus injections. Topical testosterone creams promise a total convenience, but real-world data are underwhelming. Only about 20% of users maintain therapeutic blood levels, and then only transiently, for a few hours post-application. I recall one patient, a 52-year-old executive who applied cream faithfully but still reported midday crashes, irritability, and brain fog. His serum T never rose above the bottom quartile of the reference range, despite compliant use. Injectable formulations deliver a sharp spike in testosterone, often quadrupling baseline levels in the first 24 hours, then dropping off dramatically by day 5 or 6. This surge forces aromatase enzymes to overconvert T into estrogen, leading to mood swings, water retention, and irritability. Spouses commonly report a roller coaster personality shifts that peak around injection day and bottom out just before the next dose. Beyond side effects, weekly or bi-weekly clinic visits can disrupt busy schedules and add to treatment fatigue. Beyond the erratic pharmacokinetics, creams also carry a risk of transference. Patients worry about exposing partners or children to hormone via skin-to-skin contact. Specialized gel pumps and application protocols exist, but compliance still lags. While injections remain a valid option, their pharmacokinetic fluctuations and logistical burdens make them suboptimal for many. If you've ever felt like your hormone therapy was a two-step dance of highs and lows, it might be time to explore alternatives. Comment delivery done if you're curious about smoother hormone delivery. 4. The pellet advantage. Steady, reliable, low mentalness. Enter testosterone pellets, tiny compressed cylinders of 100% bioidentical hormone, roughly the size of a tic-tac. First introduced in the 1940s, pellets are embedded subdermally, usually in the hip or buttocks, under local anesthesia. From there, fat tissue acts as a reservoir, releasing T at a near constant rate, mimicking your body's own nightly secretion patterns. In my clinic, pellet therapy has become the gold standard for steady hormone levels. Patients routinely report stable energy, improved mood, better libido, and clearer skin for 3 to 4 months post-implantation. Unlike creams or injections, pellets eliminate daily dosing burdens and clinic trips, fostering better compliance and life integration. One of my female patients, a 49-year-old marathon runner, saw her recovery times cut in half and her training performance improved dramatically after switching from creams to pellets. Side effects are minimal when dosed correctly, and the procedure, completed in under 10 minutes, has a low complication rate. The sustained release also prevents the estrogen surges seen with injections, reducing irritability and water retention. Because pellets maintain steady-state levels, patients often report better sleep quality and reduced nighttime awakenings, key for overall hormone balance. For those seeking a set-and-forget approach, pellets offer unmatched consistency. Comment pellet power if you're ready to experience uninterrupted hormone balance. 5. The 60% drop since 1970 in misleading lab ranges. A shocking demographic shift. Average male testosterone has declined by nearly 60% between 1970 and 2025, according to long-term epidemiological analyses. Yet most commercial labs still use normal ranges derived from older, healthier cohorts, or worse, from today's already depleted averages. As a result, men with dangerously low T are often told they're within normal limits. Once consulted a 45-year-old engineer whose total T measured 280 nanograms per deciliter. The lab's bottom cutoff was 250 nanograms per deciliter, so he was labeled normal despite severe symptoms. In contrast, historical data show that healthy 45-year-olds in 1970 averaged around 650 nanograms per deciliter, nearly double today's norm. This discrepancy masks an epidemic of suboptimal hormone levels linked to increased all-cause mortality, metabolic syndrome, and cardiovascular disease. Several large-scale cohort studies link each 100 nanograms per deciliter decrease in total testosterone to a 9% increase in all-cause mortality over 10 years. That means men dismissed as normal can actually face significantly higher health risks. To reclaim vitality, clinicians and patients must demand reference ranges based on robust, youthful benchmarks. Aim for mid to upper ranges of healthy 20 to 30-year-old males, around 600-900 nanograms per deciliter. and tailor treatment accordingly. Don't settle for average when optimal is within reach. Comment, range redefined, if you're ready to set new standards. 6. Testosterone in women, myths, facial hair and true benefits. Despite being the most abundant bioactive hormone in women after estrogen, testosterone remains stigmatized in female health. Common fears, deepening voice, unwanted facial hair, often deter women from life-changing therapy. Yet clinical data reveal that when properly dosed, testosterone enhances bone density, mood stability, sexual desire, and cognitive function without virilizing effects. Estrogen, not testosterone, is the primary driver of aggression. In fact, balanced T levels promote relaxation and resilience by modulating GABA and serotonin pathways. Anecdotally, I've seen peri- and postmenopausal women transition from crippling fatigue and low libido to thriving energy and confidence within weeks of pellet therapy. Minor increases in vellus hair can occur, but only in women genetically predisposed to hirsutism. And these effects are easily managed with routine laser or waxing treatments. Importantly, testosterone replacement reduces fracture risk by preserving bone mineral density, improves insulin sensitivity, and supports cardiovascular health. In the Women's Health Initiative follow-up, women on TRT plus estrogen had 25% fewer hip fractures compared to estrogen alone. For women navigating menopause or surgical oophorectomy, it's not just optional, it's foundational for whole-body wellness. Comment her strength if you believe women deserve hormone balance too. 7. Free versus total testosterone and the role of cofactors. Total testosterone measurements can be misleading. Only free T, the unbound fraction, is biologically active and able to enter cells. The rest is bound to SHBG, sex hormone binding globulin, or albumin, and high SHBG can dramatically reduce free T despite normal total levels. In practice, we always measure both, plus calculate the free androgen index to ensure accurate diagnosis. But hormones don't work in isolation. Cofactors like iodine, zinc, magnesium, vitamin D, and healthy thyroid function are essential for receptor sensitivity and intracellular transport. For example, iodine deficiency impairs the claw mechanism on cell membranes that actively pulls T inside, leaving cells starved of hormone even when blood levels are adequate. Similarly, zinc acts as a coenzyme for testosterone synthesis and receptor binding. Lifestyle factors also influence SHBG levels. High insulin, chronic stress, and liver dysfunction can raise SHBG, further reducing free T. That's why a comprehensive TRT program includes nutritional optimization, stress management, think meditation or HRV biofeedback, and regular exercise to modulate insulin and cortisol. An integrated approach, optimizing nutrient status, correcting thyroid imbalances, and targeting both free and total T, unlocks TRT's full potential. Comment Cofactor Crew if you're ready to optimize your hormone toolkit. 8. Lifestyle foundations and natural support before TRT. Before jumping straight to hormone replacement, lay a solid groundwork with lifestyle strategies proven to support endogenous testosterone production. Resistance training. Particularly heavy compound lifts like squats and deadlifts can boost T by up to 15% in as little as 4 weeks. Combine this with high-intensity interval training, HIIT, to stimulate growth hormone and testosterone surges without Nutrition is equally critical. Eat adequate protein to support muscle synthesis. Healthy fats, avocados, olive oil, nuts for hormone building blocks, and cruciferous veggies, broccoli, Brussels sprouts, to modulate estrogen metabolism. Intermittent fasting or time-restricted eating has been shown to raise morning testosterone by lowering SHBG and improving insulin sensitivity. Sleep cannot be overstated. Each hour of sleep lost below 7 hours can decrease testosterone by 10–15%. Prioritize sleep hygiene, cool, dark room, consistent schedule, and wind-down rituals to protect your hormone ramps. Finally, manage chronic stress through mindfulness, breathwork, or community support, as elevated cortisol directly suppresses testosterone synthesis. If after 3-6 months of disciplined training, eating, sleeping, and stress control, you still fall below optimal ranges, then it's time to consult an expert about TRT. This tiered approach ensures you've maximized natural pathways before medical intervention. Comment firm if you're building your hormone groundwork. Thank you for joining us on this in-depth exploration of testosterone optimization. From the hidden toxins undermining your hormone factory to the myths, methods, metrics, and natural foundations you need to master. If you found this video helpful, please like, share, and comment below with your questions or experiences. Your engagement helps us tailor future content to your needs. And don't forget to subscribe and ring the bell so you never miss our weekly evidence-based wellness strategies here on the channel. Stay curious, stay proactive, and we'll see you next week for more science-backed health tips. Until then, stay well.